Welcome to The Explainer. For decades, the words HIV and AIDS have been just surrounded by so much fear and misinformation. But today, we're going to cut right through all that noise. We're here to give you the clear, up-to-date facts so you can really understand what HIV and AIDS mean in our world today.
So let's start with a big one. HIV and AIDS. People say them in the same breath all the time, but they are not the same thing. Not even close. And honestly, getting that difference is the key to understanding everything else we're about to talk about.
Okay, first up, let's break down the virus versus the syndrome. We've got to get these two terms straight, because one is the initial infection, and the other is a condition that can develop from it, but doesn't have to. So, HIV. It stands for Human Immunodeficiency Virus. The easiest way to think about it is this. Your immune system is kind of like your body's personal security team. Well, HIV is a virus that specifically targets that team, going right after its most important players, the CD4 cells. And then you have AIDS, which stands for Acquired Immunodeficiency Syndrome. Now, this is not another virus. It's what happens in the advanced stages of an untreated HIV infection. It's when that security team, your immune system, has been so weakened that it just can't protect your body anymore from other infections. So here's the bottom line, the most important takeaway. HIV is the virus. AIDS is the syndrome, the advanced condition that might show up years down the road if that virus is left untreated. But, and this is a huge but, with today's medicine, a person can live a long, perfectly healthy life with HIV and never, ever progress to AIDS. All right, now that we've got that straight, let's talk about transmission and risk. Because honestly, understanding how HIV actually spreads is one of the best ways to protect yourself and everyone around you. So here's the deal. HIV can only be transmitted when very specific body fluids from a person with HIV get into the bloodstream of someone else. We're talking about fluids like blood, semen, rectal and vaginal fluids, and breast milk. It's not just floating around in the air. It needs a direct path to get in. So how does that happen? Well, there are a few main ways. Globally, the most common are unprotected sex and sharing needles or other equipment for injections. It can also pass from a mother to her child, although that's become super preventable now. And while contaminated blood was a huge worry in the past, today our blood supply is screened so well that transmission this way is incredibly rare. And all of this leads to some really good news. Because even though the risk is real, HIV is also one of the most preventable viruses out there. We have this amazing set of tools and strategies now that are proven to work. The trick to prevention is that it's not just one thing. It's a layered approach. Think of it like a toolkit. Condoms? Yeah, they're still a vital tool in the kit. Regular testing is also absolutely fundamental. You can't protect yourself or anyone else if you don't know your status. And now, we have these powerful medical tools like PrEP. That's a daily pill to prevent HIV, and something called treatment as prevention, which, as we're about to see, has been a complete game changer. And the toolkit doesn't stop there. There are other really important strategies too. Things like limiting your number of sexual partners can lower your risk. Getting any other STIs treated right away is also key, since they can make it easier for HIV to transmit. For people who inject drugs, always using sterile supplies is critical. And for those just-in-case emergency situations, there's something called PEP, which is a course of meds you can start within 72 hours of a potential exposure to prevent infection. Okay, this brings us to what is maybe the most hopeful, most revolutionary part of the whole HIV story today, the unbelievable effectiveness of modern treatment. Seriously, this has changed everything. The game changer is a treatment called antiretroviral therapy, or ART for short. What is it? It's a medication, usually just one pill a day, that works by stopping HIV from making copies of itself in your body. It doesn't cure HIV, no, but it controls it brilliantly. And that control leads to a scientific fact that is one of the biggest public health messages of our lifetime. Undetectable equals untransmittable. You equals you. It means that when ART lowers the amount of HIV in someone's blood to levels so low they're called undetectable, that person cannot sexually transmit the virus to a partner. It's not a guess, it's not a theory, it's a proven fact. So what does all this mean? It means a person with HIV who gets on treatment early and sticks with it can now expect to live a long, healthy, basically normal lifespan. That's it. Thanks to ART, HIV has gone from being a terminal illness to a manageable chronic condition. You know, with all this amazing science, it makes it even more important that we finally put some of those old fears to rest. So let's tackle the myths that are still floating around and just smash them with the proven medical facts. Let's start with the biggest myth of them all, that you can get HIV from just, being around someone. This is absolutely 100% false. You cannot get HIV from hugging, from sharing a meal, from a toilet seat, from a handshake. None of it. The virus simply does not spread that way. Period. Next up is the myth that getting diagnosed with HIV is a death sentence. That idea is it's a ghost from the past. It's completely outdated. Today, with effective treatment, HIV is a manageable chronic condition, just like diabetes or high blood pressure. People with HIV live long, healthy, amazing lives. And finally, there's this dangerous myth that you can somehow just look at someone and tell if they have HIV. You can't. A person can have HIV for years and have zero symptoms, look and feel totally healthy. That's why testing is so important. It is literally the only way to know for sure. So we've walked through the virus, the prevention, and the incredible treatments that have totally turned this story from one of fear to one of facts and hope. So the last question, it isn't really for me to answer. It's for you. All this knowledge you now have, it's power. So how are you going to use it? How will you challenge the myths you hear, support the people in your life, and help end the stigma for good?